Coronavirus cases fueled by the Delta variant continue to surge, primarily among the unvaccinated, as the FDA authorizes booster shots for some people and more employers are requiring vaccination as a condition for returning to work. Joining us now to discuss the latest guidance, the director of the National Institutes of Health, Dr. Francis Collins. Dr. Collins, let's start with the latest figures on this fourth wave of the coronavirus. I want to put the stats up on the screen. The latest average of new cases is more than 129,000 new cases a day. That's up more than 700% from the beginning of July. Assuming current trends of the spread of the virus and assuming the current level of vaccinations, how high could this wave get before it crests? How many new cases could we be seeing a day?
Well, Chris, we can't really predict that. All we can say is that this is going very steeply upward with no signs of having peaked out. So I will be surprised if we don't cross 200,000 cases a day in the next couple of weeks. And that's heartbreaking, considering we never thought we would be back in that space again. That was January, February. That shouldn't be August. But here we are with Delta variant, which is so contagious, and this heartbreaking situation where 90 million people are still unvaccinated who are sitting ducks for this virus. And that's the mess we're in. We're in a world of hurt, and it's a critical juncture to try to do everything we can to turn that around.
We are also seeing a sharp rise in the number of pediatric cases, both unvaccinated kids and vaccinated kids who are getting COVID from this new Delta variant. How bad could that spike in pediatric cases get?
That's very worrisome. I think traditionally people kind of considered, well, you know, kids aren't going to get that sick with this. More than 400 children have died of COVID-19. And right now we have almost 2,000 kids in the hospital, many of them in ICUs, some of them under the age of 4. So anybody who tries to tell you, well, don't worry about the kids, the virus won't really bother them, that's not the evidence. And especially with Delta being so contagious, kids are very seriously at risk. And it's up to all of us to do everything we can to protect them, as well as we're trying to protect everybody else at the same time.
You talk about protecting them. 7 states across the country have bans in place, bans against mandates for school masks for these kids when they're in school. And Florida Governor Ron DeSantis is leading the charge. Here he was this week, sir.
If you're coming after the rights of parents in Florida, I'm standing in your way. I'm not going to let you get away with it.
How strong is the case that children in school should wear masks as a mitigation against Delta?
Chris, it's very strong. Go to the CDC website. You'll see more than a dozen publications showing that evidence. And already you can see in this country the schools that have started to open without mask requirements, outbreaks are happening. And what happens then? The kids are sent home for virtual learning, which is what we were trying to avoid. It's really unfortunate that politics and polarization have gotten in the way of a simple public health measure. This mask that I'm holding has somehow become a symbol that it never should have been. This is basically just a life-saving medical device. And somehow it's now being seen as an invasion of your personal liberty. We never should have gone there. It's heartbreaking for me as a person who's not a politician. I'm a scientist. I'm a public health person. I'm a doctor, to see how masks have gotten into this very strange place with parents and others shouting about it. We never should allow that to happen.
I want to pick up on that because the Board of Education in Williamson County, Tennessee, near Nashville, held a meeting this week on the issue of mask mandates, and there were some parents in the group, including some doctors who had kids in the school, who were urging that everybody wear masks, that there be a mask mandate. And I want to play the reaction, the scene in the parking lot after the meeting of the school board. Here they are.
We know who you are. We know who you are. You can leave freely, but we will find you, and we know who you are.
You will never be allowed in public again. You will never be allowed. You'll never let it be allowed in public again.
As the head of the National Institutes of Health, as a person who's devoted your life to public health, what's your reaction, sir, when you see that?
Well, it's devastating that we in this country, the most advanced technological society on the planet, has somehow slipped into a space where the evidence and the basis for making decisions on facts has gotten pushed aside by politics, by social media conspiracies, and by this incredible depth of anger and grievance that seems to be held by so many. Our future as a nation has got to revolve around coming away from that kind of approach to everything, or I don't see how we're going to solve all of our society's problems, which are looming in front of us. If I have one thing I'm worried about, it's not just the epidemic of COVID-19, it's the epidemic of misinformation, disinformation, distrust that is tearing us apart.
One of the big questions now, Dr. Collins, is whether or not all of us who got the vaccines in the first place are going to need a third shot or a booster, whatever you want to call it, because of declining protection from the vaccine over time. Now, you and the CDC and all the top government scientists are saying, well, maybe sometime later this fall, maybe early next year. But in Israel right now, they are giving the third shots to everybody over 60, and starting this week, they're going to be giving the shot to everybody over 50, which raises the question, do they know something we don't, sir?
Well, we're looking very closely at their data as well as our own. This is a tricky situation. First, let's point out that just on Friday, CDC's advisory group, and the CDC director accepted it, approved a third shot for people who have immunocompromise. But that's a separate question. What about the rest of us? Again, we are looking at this data almost daily, yet there is a concern that the vaccine may start to wane in its effectiveness over months, and Delta is a nasty one for us to try to deal with. The combination of those two means we may need boosters, maybe beginning first with healthcare providers as well as people in nursing homes, and then gradually moving forward. We have not made that decision yet because right now the data we have from the U.S. says people who are vaccinated are fully protected, even against Delta. When you're talking about severe disease, you're not going to end up in the hospital if you had that vaccination. And of course, the big message right now this morning is, Chris, for the people who aren't vaccinated, this is the moment to absolutely get off the fence and take care of this, because you are a sitting duck for this virus. It's looking for you.
But you must know that there are people who did get vaccinated who are seeing, and there have been some studies, as you say, it doesn't indicate people are going to get, certainly be hospitalized or die, but that the protection from the vaccine is waning. And as you know, some people have gone and gotten a third booster on their own in this country, you know, either lied about it or whatever. And you know, if you're looking at what's going on in Israel, which seems like a pretty safe and careful country, why shouldn't you say, well, if they're doing it, I'll do it?
Well, in fact, that is the question we're asking closely. Remember, Israel had Delta hit them sooner than it did us. So in a certain way, the timetable we're looking at is stepped back a bit because of the spread of this virus. That's part of it. But also, we're a different kind of country with different situations. We are getting increasing amount of data from the U.S., especially the next couple of weeks. We're going to see a lot since Delta really started hitting hard in July. And then we'll make a decision. And again, I don't think it's right for people to jump the gun until we really have the evidence. We're back to where we were a minute ago, Chris. We're a nation that's supposed to make decisions based on evidence. Let's try to apply that here, too.
Finally, Governor DeSantis blames President Trump for spreading COVID by letting so many people with COVID into the country illegally. Here was Governor DeSantis on that.
Whatever variants are around the world, they're coming across that southern border. And so he's not shutting down the virus, he's helping to facilitate it in our country.
You talk about dealing with the science, dealing with facts. I'm going to ask you about that. In parts of Texas, the positivity rate for COVID among some of the illegal migrants coming across the border is over 10%. How responsible are they for spreading, for this wave of COVID that is sweeping the country right now?
Well, it's certainly a cause of concern. They have very significant masking requirements there, but it is certainly possible. But, you know, let nobody try to say that's why the U.S. is in trouble. The rate of infection in Mexico is actually lower than it is right now in places like Texas and Louisiana and Florida. I think that's a bit of a distraction. We've got enough of a problem with our own citizens who have refused to roll up their sleeves. So maybe that would be a better thing to focus on if we're trying to end this. That seemed like it was not going to get us where we need to be. It's an issue, but it's certainly not the cause of our current dilemma.
Dr. Collins, thank you. Thanks for sharing part of your weekend with us. Always good to talk with you, sir. Please come back.